Hey guys, this is Dr. Shumard with Integrated Wellness Center of San Diego. And today I wanted to talk to you about a very important condition, one of the most common conditions that we work with in our office, and it's called Hashimoto's thyroiditis. So, for those of you who are dealing with thyroid conditions, most people, when they're being diagnosed with hypothyroidism. And if you're not familiar with this whole thing, you can look back on one of my previous uh, webinars that I've done, or one of my previous videos that I've done in regards to thyroid conditions. But the most common type of thyroid condition diagnosed is a low thyroid or hypothyroid. Now, what's interesting is that that's pretty much where everything stops. At that point, when the person is diagnosed with that condition, they're then given a medication, a thyroid hormone medication that could be levothyroxine, Synthroid, or it could be one of the bioidenticals, Nature Throid, WP Thyroid, something like that, Armor, those sort of things. But what's interesting is that's pretty much where the extent stops. And for most individuals that are dealing with thyroid conditions, typically females, they're going to continue to suffer. They're going to continue to feel not well and continue to have symptoms that are driving them in some situations to go a little crazy as well. Now, for many people, they'll go on to Dr. Google or somewhere else and start searching to see what else could be going on, and they may come across with a condition called Hashimoto's thyroiditis. Now, this condition is actually an autoimmune disease, and I've broken this condition down more in one of my previous videos, so make sure you look through our list of videos that we have, and you can see where I've broken this condition down. But just to briefly go over this, what's very interesting about this condition is that about 90 to 95% of all thyroid cases, including hyperthyroid cases, is due to a condition like Hashimoto's thyroiditis, because what that is an autoimmune disease. It's where the immune system starts attacking and destroying and literally killing the thyroid until one day the thyroid can no longer do its job and the person gets diagnosed with a condition like hypothyroidism. Now, what's interesting is if 90 to 95% of all cases is actually due to this underlying autoimmune disease, specifically in this case Hashimoto's, why is the person only being given a thyroid hormone? Why are they only being given a hormone and not addressing the autoimmune? See, I talk about this deeper into my webinar. If you want to attend my next webinar, make sure you comment below with your information, and I'll make sure we get you that information. But for most people that are dealing with this type of condition, they're just not being fully analyzed. They're not being fully diagnosed, if you will. Now, for those of you who are engaging and you're looking for options, they may look to see if they have Hashimoto's, but most doctors are not going to test for this. Most doctors, unless you drive them and tell them you want to test for it, they won't test for it. And the main reason is because there's not much that can be done in a medical model. There's not any pharmaceutical drugs that can treat the autoimmune. So the person is left to continue getting sicker and sicker, and the only options for them is to take more medications to address the symptoms instead of fixing the problem, which is the underlying autoimmune Hashimoto's. So in this specific example here, when you have an underlying autoimmune, the immune system is the problem, not the tissue. And in reality, it doesn't really matter what tissue is being attacked, it's still the immune system. So it could be, for example, the pancreas, which is if the immune system is attacking the pancreas, that's called type 1 diabetes. If it's attacking your skin, that could be things like eczema or psoriatic arthritis, or something other type of condition like that. If it's attacking your digestive tract, it could be celiac disease, or some other type of underlying mechanisms that are involved with digestive problems where the immune system is attacking it. It could be something like lupus. So the tissue itself is irrelevant because it's the immune system. And that's what I want to focus on today, because I talk to a lot of individuals, number one, who've never heard of Hashimoto's, and number two, don't know what to do when they have this. Their thought is, all I can do is to take medications for my thyroid, or they're taking other supplements they have found online that can support the thyroid, like selenium or something else, other types of supplements. Now, there's nothing wrong with doing those things, but it's not impacting the cause, what I refer to it. So in this specific situation, when you have a thyroid condition and you are diagnosed, and by the way, it's very easy and simple to diagnose this condition. What's not is figuring out what else is going on, which is what we're going to talk about next. So what I refer to what are the triggers, if you will. So once you understand that you have an underlying autoimmune, well, now you know the cause of your thyroid. And I give this analogy a lot in my webinars. I talk about this analogy in the sense that, if I come up and attack someone or I punch them in the face for 30 days in a row straight, what's their face going to look like? It's going to be black and blue. It's going to be bloody. It's going to be black eyes. It's going to be a broken jaw, broken teeth, whatever it might be. There's going to be problems that are going on that the person has to deal with. Now, the question I always ask is their face the problem? Well, of course it's not the problem. It's me punching them in the face that's the issue, which is causing all of this dysfunction in their face, bruising everything. Well, the example, this analogy, if you will, is no different for your thyroid. If your thyroid is being attacked by the immune system, your thyroid is not the problem, your immune system is the problem. So why is it that in a traditional model that the treatment is for the thyroid, giving you thyroid hormones, and not really addressing the underlying mechanism? Well, that's a question you should ask the traditional medicine. It's because there's no really options, if you will, to address the immune system. There's no medications. And if you look at the traditional model, the typical model is, what can we use to give you to treat the condition? What can we give you to treat the symptom? Meaning, what medication or pharmaceutical drug can we give you? If there is none, then we can't address that specific problem. And Hashimoto's is one of those issues. So once you understand what the cause is, which is the immune system, well, you have to take one more step. Remember, when we're dealing with things from a functional model or a functional health analysis, we want to understand the specifics, getting down below the surface, down to the roots, if you will, below the surface, into that dirt. If you're a gardener, you want to find out what's really going on, and that's how you really make changes in an individual's life. So once you have the symptom, in this specific situation, the symptom is the thyroid being low, the thyroid not able to produce the hormone anymore. That is not the cause, that is not the problem. So one step back in this situation, this example, is the Hashimoto's. It's the immune system attacking and causing that thyroid to not work any longer. When we take one more step even further, what is triggering the immune system? Why is the immune system attacking the thyroid in the first place? What happened? What's going on under the surface? And that's what I want to really discuss and just briefly talk about today. And that's what I refer to as the triggers. What is triggering the immune system to attack the thyroid? And when we focus on the triggers, that's when you make major differences. Because when you address the triggers or you eliminate the triggers, now there's no antagonizing onto the immune system, or there's nothing triggering the immune system to attack the thyroid, which now we have reduced attacks on the thyroid, or stopping the attacks on the thyroid, is also referred to as arresting the attacks. Now the person starts to feel better. So hopefully this starts to make sense that we're not addressing specifically the thyroid, the diagnosis, the condition, whatever it might be. We're addressing the underlying, the deeper down mechanisms that is dysfunctional, that's not working appropriately, that is contributing to the attacks. So let's talk about some of those types of things that we see in the practice that could be the triggers that you're specifically dealing with. I'm going to use a different color pen here.